Thank you, Julie. Really appreciate your help with us this morning, co-hosting with us. I'm delighted to be here along with my colleague, Dr. Carolyn Davis, and welcome to all of the attendees. We're excited to be having this day-long Psyched for the Future conference and share with you some of our experiences in the field of psychology so that you can get excited about what we're doing and hopefully get excited for your own career paths. Our presentation this morning is really going to be looking at kind of two things. The first is we want to set an expectation around what does it mean to be an engaged student, a trainee within clinical psychology, because we could talk about specific skills or knowledge, but really what we want to emphasize today is that engagement and that ability to be flexible and adaptive in a changing world, and how that impacts you as a student or a potential student and a future clinical psychologist. So to do that, we're going to talk about three specific critical issues that have been impacting the field over the last few years, and how we have experienced those changes and how they affect students and trainers within the field. But let me first have us both introduce ourselves and tell you a little bit about our backgrounds within the field. So my name is Dr. Tracy Marsh. I'm delighted to be here. I went through my undergraduate at the University of California, Santa Cruz. For those of you who know, our mascot is the banana slug, so go slugs. And then I did my doctoral work in the counseling psychology program at the University of Southern California. I fully expected to go right out of my doctoral program into full-time practice, and it didn't work that way at all. I took a very circuitous route. I worked in education, for-profit education, for about 10 years, learning about all things related to education, including distance education. Following that, I decided I really missed the university environment. I missed teaching, and I accepted a position here at Walden in the, at the time, the counseling psychology program, and have just loved the journey for the last 15 years here. So one of the pieces of advice or pearls of wisdom, if you will, I would start off with is don't close off any options when you're thinking about your career. You might be surprised where your path takes you. Let me hand it over to my esteemed colleague, Dr. Davis.
I agree 100% with everything that Dr. Marsh just shared. And good afternoon, everyone. As Dr. Marsh shared, I am Dr. Carolyn Davis. I am core faculty in the clinical psych program. Very similarly, my journey was interesting to get to this point. Did my undergraduate and master's work at Michigan State University. As you all know, our mascot was a Spartan, one of the most well-known mascots in collegiate sports, just saying. And then I did my doctoral work at Tennessee State University, which was really interesting. My doctoral program had a very specific multicultural framework in my studies. It's a historically Black college and university. And so while my program was steeped in traditional training, there was also an additional multicultural lens and focus and framework for our training. So a bit different than most doctoral programs at that time. That has changed much, and I'm probably dating myself, but that was a long time ago. Traditionally went into a university counseling center and was a staff psychologist for a number of years, as well as faculty for the universities that I worked for. So I would do a lot of the training courses for practicum and internship, and then also had a sports and performance expertise. So I taught some of the courses around sports psychology for undergraduate and graduate students. But around that time, we were taking a shift in the field of education and moving a lot of coursework online. At the time, I was one of the few faculty that were in brick and mortar institutions, but teaching online classes. At that time, it was a very skeletal setup, nothing like the very involved systems we have now at Walden, which is wonderful. So I sort of started pretty early on in online education outside of an online environment, trying to create an online environment in a brick and mortar institution, and really loved it. I found the value in being able to support students doing their work in this way, certainly being able to attract students who wouldn't be able to take traditional pathways in terms of completing their degrees. And I actually had taken a course at Walden in my doctoral studies when I was away on internship and was audited and found out that I was missing a class that I thought had transferred over from my master's program, and it did not. So I'd had an amazing experience at Walden, had wonderful faculty, loved the way that the online process was set up, and started working at Walden. It's been a little over 12 years now. It's been a wonderful experience for me. I've been able to have colleagues like Dr. Marsh and so many others that have just been, very influential in my journey, and in this field just across the board. So we're very happy to be here with you this afternoon and talk about what it looks like in our field in terms of critical issues in clinical psych.
So I think one of the points that we really want to focus on here at the beginning and have as a thread throughout, and we will revisit at the end, is psychology is really a dynamic profession. I remember when I was in my doctoral program and I heard a piece of information. Now, I can't speak to how true it actually is, but I think there's a fair bit of truth in that, and that is, whatever you learn in graduate school, within 7 years, half of it will be outdated. I don't know, Dr. Davis, if you ever heard anything like that, but the idea is we're given a solid base of information, but the field is always changing, and you have to be engaged and following what's going on and connected with the research, because nothing really stays static. Real world events impact our training and our work. And we'll talk more about that in a minute. Our interventions and our assessments are continually evolving. What we do today when we are working with a client or doing an assessment, we are not using the same techniques or the same tools we used 10 years ago, certainly not 20 or 30 years ago. And a successful psychologist is nimble. They can tolerate ambiguity. Being able to ride those waves as they change over the years.
Mm-hmm. One of the things that I love that Dr. Marsh said earlier in her introduction is don't put yourself in a box, be open to the opportunity that will come your way. I think we've seen this show up over the last really almost 3 years that we've been navigating this pandemic, as well as, other issues that we've seen really sort of expose themselves in new ways around social justice and equity, things across the board, where folks that have this training, this background, and this expertise are being called into those spaces to provide support, to provide education, to provide expertise. And so I really think it's important to be open to whatever pathways that you can operate in, because you're being called in ways that you've never been before, really, to do this work. So it is an exciting time to be a psychologist, right?
It really is. It really is. And, all we have to do is, if we look at our history, we know that real world events have impacted our profession. Probably one of the more well-known events that happened was both World War I and World War II, and how they radically influenced psychology in terms of what we do with assessments. If you envision what was happening, for example, in World War II, there was this huge draft, and the armed services didn't really have a process for how to handle all of these incoming individuals and where to place them, how to assess their skills, their talents, what would be the right fit for them. And psychology partnered with the military at that point to come up with some robust ways for assessing intelligence, cognitive skills, career paths, achievement. That was a mutually beneficial experience. It provided a really valid and necessary service to what was happening in the armed services, and it also allowed us to evolve tremendously in terms of our assessment skills. Treatments also change over time. And it's another reason why when you get out into the field and you're practicing, you can't simply hang your shingle and then never look at the research again. That becomes very dangerous. One example is there is a technique that was used for a long time called critical incident debriefing, where after a very traumatic event, the belief was that talking with that person and really having them relive it a number of times was going to be beneficial. And subsequent research showed it's very tricky and can be quite dangerous. So again, staying connected through a number of channels to what we continually are learning is really vital to being a successful and ethical practitioner. I think we can go ahead and go to the next slide, if you would. Okay, so this is the first of our three critical issues. Probably not a surprise. COVID-19, boy, I think we've all experienced in different ways the last 2.5 years and how it has disrupted every aspect of life. And it has certainly disrupted the field of psychology and also provided some important opportunities as well. We know, for example, the significant impact that the pandemic has had on mental health. APA, the American Psychological Association, has done a number of surveys over the last 2 years, and all of the indices have gone up. Anxiety and depression, in one recent survey, 4 times, the reported rates are 4 times higher than pre-pandemic. Loneliness, grief, stress from all of the necessary changes that have happened as a result of the pandemic.
And I would just also add just the emotional impact across communities. Some communities were impacted at much greater rates, higher rates. And so there's been a lot of just emotional shift, grief, loss, concern, mistrust, distrust, things like that as it relates to what we now will operate in going forward and how people move forward with protocol and protection and all sorts of issues concerning their safety going forward as it relates to COVID. It has definitely changed, I think, the world we're living in and the way we'll practice going forward.
For sure. It's as faculty in a training program, we saw how it impacted us. It changed training across the board. Now, I will say we were probably in a much better position than a lot of training programs that are fully on the ground. And I say that because we have been doing online education and blended education for many years. We have developed courses, methods for doing this. Just in talking with colleagues who were both teaching and also practicing, for some, it literally was over the course of a weekend, you had to move from teaching on campus to now teaching over Zoom. And in the research, there's been a term which I think is important to recognize. It's not that a lot of places were providing online learning, but emergency remote teaching, which is very different. And I think folks did an amazing job doing the best they could, but it was rough. And I think any of you with kids who experienced that transition, for anybody from K through 12, how hard that was to make that shift. We had students both here at Walden and at other institutions that had folks out on field training, and sites were shutting down because of the risk of COVID. And how do we manage that disruption? So again, thinking about how to be nimble, how to find comfort in adjusting to ambiguity when it's happening is a super important skill within this field. One of the things
I remember
please go ahead.
Oh, no, I was just going to say, I remember we were in the middle of BAYR. Students were actually at the hotel. We were getting ready to begin our blended residency, which is a navigating schedules and flexibility and planning, then COVID changed everything. We had to figure out how to address, and at home virtual instruction, and the students who were already, beginning their travel. Field training was a significant transition. It was just so much that had to happen, on behalf of the institution, on behalf of the students, the faculty. I've never had a transition impact us professionally in such a way
Mm,
ever, you know.
yeah.
And now I think we're experts in it going forward. So we developed a new skill of expertise in the field of remote learning, and that one of the gifts of having been at Walden, in a remote and online learning environment for so long. I think we were able to be incredibly flexible, transition incredibly well. And I'm not just saying that because it's Walden. I'm saying it because I think we did a good job in light of what was happening. And having the background where folks were psychologists and understood the stress, the emotional stress, the academic stress, the worry about their experiences, and also took that into account in terms of our planning and how we moved forward as educators, both from the framework of faculty and psychologists alike. So I think those were amazing gifts in a situation where, other folks didn't fare so well.
Yep.
And they made the transition, but maybe there were some things that were left out because they didn't have a psychologist's perspective or consideration or experience. So I was very grateful
Yeah.
that I had a team of folks who were thinking what I was thinking along the way,
Mm,
about our students and
absolutely.
our faculty's experience.
Yep. One of the things that, and I suspect, Dr. Davis, this may be true for you too, for all of my doctoral mentees, the students that I have where I am their chair for their dissertation, we're talking about COVID regardless of their topic because it
Absolutely.
touches everything. And so whether we're
Absolutely.
collecting data during COVID or analyzing data post-COVID, it's something now that really needs to appear as a consideration at some point in their
Absolutely.
research. It's that broad. And one of the other areas that we're seeing certainly information starting to come out, I think we're still at the very beginning edge of it, is this phenomenon that has become known as long COVID. And that is individuals who contract COVID, recover from the initial illness, but have symptoms that persist for, at this point, months, sometimes years. And what we're seeing now are hospitals starting to open up centers just to treat long COVID. And there are a whole host of physical and neurological symptoms. There's also psychological impact. Um, Reported issues with anxiety and depression again, brain fog, feeling like your thinking isn't like it used to be, are some of those issues that folks are dealing with. And that certainly presents opportunities for folks in the field to work in an integrative fashion with primary healthcare systems. How can we help support treatment for folks who've dealt with long COVID?
Absolutely.
One of the other pieces I think that's important to acknowledge is just burnout among mental health professionals. Um, you know, Shifting again overnight to working remotely has been hard, and there's a number of reasons for that. And we'll talk a little bit about that in our third topic. But just the reported rates of burnout have really skyrocketed. Again, APA did a survey, almost half of surveyed practitioners reported feeling burned out. Their caseloads are higher, their waiting lists have gotten longer, demand for services. I think most of the clinicians I know right now, they're fully booked. They don't have openings because the demand, again, related to that first point where we are seeing such great increases in anxiety and depression and stress and grief, have prompted individuals to seek treatment. Did you want to make any additional points on this one, Dr. Davis?
No, I think that's absolutely true. As COVID sort of circulated across the world, so and for psychological support, not just for people who were already, seeking therapy and wanting to continue it online, But for those folks who had no idea how to navigate the world going forward, who were dealing with grief and loss at an exponential rate, remember COVID happened also during the time we were dealing with significant social justice issues in the US. Folks were dealing with a lot of trauma, a lot of vicarious trauma, things that were outside of COVID, but just as significant. And the demand was so high to the point where some psychologists couldn't keep up with their caseload. There were clients constantly asking for appointments and support. And I think burnout is also something that we're seeing happen in a very unique way, both during COVID and now. Well, I guess we're still in COVID, but and what some folks are calling post-COVID, which I don't know that we can call it that yet. But I
Yeah.
think the demand is still high, and now those needs are going to shift as we move out of one emergency state into a less urgent but still emergency state, I think,
Mhm.
and into management. And all people are now used to having this virtual space be provided for them. Those that are going back to in-person practice are still maintaining telehealth services, and so they're doing both. And that's become a bit of a burnout space also, is the back and forth between in-person work and now telehealth work, which I think is the direction that will likely remain in
Mhm.
now that that's been introduced in such a widespread way. Yeah.
Absolutely. Thank you. I think we can go ahead to the next slide.
Yeah. So part of what we've already touched on, and we spent quite a bit of our time as faculty when we think about our students and our programs and in our personal lives, focusing in on what's happening across the world. One of the things that is critical and required in the field of clinical psychology is multicultural competency and training. And many of the why of that, if you will, has been seen over the last few years in terms of social justice movements. We've seen huge social justice movements across the United States and outside of the United States during the last few years around every issue and layer of identity that you can consider: racial and ethnic concerns, sexual orientation concerns, equality, equity, all sorts of work that's really sort of come to a forefront and really had a larger audience and a larger push toward awareness, if you will. That's had a huge impact on how we do this work, where we do this work. There are places, companies, small businesses, large agencies that are asking for psychologists to come in and be able to do work around multicultural competency and awareness and training in ways that we've been used before, but I don't think at the level that we have now, particularly around those significant trauma related experiences that have been televised or, directly witnessed, so on and so forth. And what we're seeing now is many agencies that have had inappropriate, unethical, discriminatory practices in the past really begin to take ownership of those things and try to move organizations and businesses forward in a different direction. Our governing body of APA, the American Psychological Association, has done the same. And there was a huge moment, if you will, in APA regarding what's known as the apology. That feels a little bit LeBronish when we talk about the decision, but the apology, which really sort of took account of its history and its practices, much of which was steeped in very discriminatory tendencies, research practices, diagnoses, things like that that have harmed some communities, some more than others, and really promised to do the work going forward for rectifying much of that, for training many of those marginalized and disenfranchised groups, and making sure that there's representation across the field of psychology, so that when we're doing this work, we're doing it from not only a competent foundation, but also making sure that there's representation of those
Mhm.
communities doing the work in the field of psychology. That's huge. It's a huge movement. It was a very strong statement. Other agencies are doing the same. And it really is going to be interesting the way in which we move forward as clinical psychologists around this area of multicultural competency and change. That's a big deal. You'll see Walden also making some shifts and transitions to really incorporate multicultural competency in the work that we do as an institution, as your faculty, as your staff, all of these things across the university. We know that multicultural competency has had a significant impact in our field across the board, particularly for those who have it and those who don't, in training, in teaching, in advocacy, in so many areas. And so we're seeing this really come up as a place where people are looking for those who are well expertise and well trained in this area. And also something that you'll find is important to be aware of. We are always advocates. Once you move into the field of mental health, as particularly as licensed psychologists, part of your role, part of your expectation is advocacy. And so much of what you'll spend time doing is working in this particular critical area around legislation that supports and impacts those groups who are marginalized or disenfranchised, to make sure that their voices are heard, their needs are met. We tend to have a much broader view of those things because these are our clients. These are the people we work with. These are the students we serve. These are the folks that we have an opportunity to serve on a regular basis. And so we're able to sort of raise our voice in the field of psychology to support them legislatively, public policy, in ways that most folks don't get to sit at the table and advocate for marginalized or disenfranchised populations. And this is a huge area right now in the field of psychology where folks who have this background, have this experience, have this training are being asked to step up and support and lead and speak for and speak on behalf of. So multicultural competency, I think, is a critical issue across our world right now, not just in the field of psychology, but we're seeing a pretty significant impact in the field of psychology for obvious reasons. You know, when you think about what is the impact of mental health treatment, of diagnoses, of assessment, of therapy, that's huge. And so, of course, we would need to have training, we would need to have expertise, but we will also need to serve as advocates and voices for those folks who are these people that are marginalized and disenfranchised groups, particularly for such a time as this across the world.
Absolutely. Yeah, and I want to really amplify that point. I think this is one area where, as a student within the field, as an early career professional, and certainly as a seasoned professional, there are opportunities not just to use that to develop and use that competency in work with individuals, but this is really where you have an opportunity to get involved in a much broader way. I think APA has a complicated history here, thus the need for the apology. But there are also instances where they've done very good things in terms of being a friend to the court, providing amicus briefs on certain issues that have come that are legislative in nature. For example, we've seen in the last 10 years lots of legislation cropping up that essentially would allow for discrimination of certain disenfranchised groups by clinicians. And APA was one of a number of professional organizations that went on record to say, this is not good, this is harmful, we oppose it strongly. So whether it's through your local organization, state or national or international organizations, it's a chance to be involved and have an impact at a very broad level. Let's go ahead to our third issue. Thank you. And this we've kind of touched on with both the previous slides. Because of COVID, certainly, but not exclusively COVID, because telehealth existed before the pandemic, we are seeing a radical shift to how we do telehealth, where we do telehealth. And in that, it puts a demand on all of us in some unique ways. So for example, one of the things I think that was recognized right out the gate was, just because you do therapy, does that mean you're competent to do therapy over Zoom? And the answer is no. um, so there was some good training that was available early in the pandemic, and an ethical, responsible clinician would have taken advantage of that. You know, it's everything from ensuring that the platform you're using is secure and HIPAA compliant, to understanding, you know, what are the rules and regulations if your client happens to be in a state that's not where you're licensed. So this was a really dynamic, changing situation. And I think a lot of us were scrambling to figure out how to do, how to provide services, not just therapy, but assessment online. Think about doing a assessment battery, an intelligence, cognitive neuropsych battery. There was a lot of work in terms of thinking about how to do that in a remote fashion, what could be done and what really wasn't appropriate to do remotely. One of the other issues is access. I think this was a double-edged sword for the field, and continues to be so. Certainly having the ability to attend a session online meant that individuals could do it in a geographically independent way. You didn't have to go to the office. It allowed folks who moved because of COVID, or an independent of COVID who live in rural areas to get services that they could not get locally. So this was really important. The flip side to that, of course, is not everybody has stable internet. Not everybody has the appropriate technology to effectively receive services online. So until we reach that level of access, there's work to be done.
Absolutely.
Something I suspect a lot of you may have experienced in your workplace, in your studies, is something called Zoom fatigue, and it's real. And there have been some important research that started to be done on this. The bottom line is our brains right now are working harder because we're doing this remotely than if we were all in a room together and Dr. Davis and I were presenting to you live. And there's a lot of details around why that is, but it puts a greater cognitive load on your brain. Mm-hmm. So again, it's incumbent upon us as professionals and you as students or potential students to be thinking about, how might this impact my progression in the field? Are there opportunities here? And I would say certainly to continue to understand the impact of technology on us as individuals and how we receive services, or simply even interacting with technology. And finally, where you practice. I've heard some pretty interesting anecdotes from folks who made that initial transition to doing therapy online about what it was like to see clients when they were in their homes. I recall one individual actually two different clinicians who had experiences where clients showed up with a beer or a cocktail because it felt more casual. Some clients might be in pajamas. So it presents some unique situations that are different than we would probably experience in the office. So I think, again, so much interesting stuff here for us as clinicians to be thinking about.
For sure.
I know we're running short on time. I'm going to just jump us kind of to our last slides, and I apologize for kind of whipping through this last one, but this, hopefully at this point, these aren't going to be new ideas, that you're starting to get a sense of this as we've gone through. So how do you stay nimble and engaged as a student, as a trainee in this field? Absolutely invest in joining in professional organizations. It's one way that you will stay appraised with what's going on. I'm a member both of APA and also my state association, California Psych Association. That's really my lifeline to what's happening, these current and critical issues. Go to conferences, both within psychology, but I'd encourage you to go to some conferences outside of the field, public health, nursing, education. Specialties within the field that aren't your specialty, sports psychology, forensic psychology. It helps you start to connect the dots. Get involved in real world causes. We've talked a little bit, for example, about the social justice movement. There's a lot happening in the world right now, domestically and internationally. Stay engaged, stay involved. Your clients will be coming in and dealing with those things. You need to be aware and sensitive to how it impacts them. And certainly be a lifelong learner. You know, your education will not stop when you graduate. It's one of the things I love about working in a university is that I get to indulge my passion for learning every day. Dr. Davis, additional thoughts?
Absolutely. I would just conclude with, complete agreement with all of that as we started off with this discussion around psychology being such a fluid field and ever growing and ever changing. And that's the wonderful thing about it. And so being mindful of the many ways that you can engage, that you can learn, that you can train, that you can advance your education, advance your experience. I also am a member of both, APA and my state organization, but I'm also a member of the specialty areas in which I practice. But any opportunity I have to train in social work and health systems and other areas, I do, because much of the work that we do is integrated. I do a lot of work around DEI and multicultural competency. I don't necessarily always get that training in psychology. Sometimes it's a human resources training. Sometimes it's a social work training, something like that. I'll go. It doesn't matter that it's not psychology focused. It matters that I have an opportunity to learn. So always engage wherever you can, however you can in that experience. You'll find our field continue to expand, I believe. And you'll be called on in different places and spaces to do this work. As many opportunities as you have to be flexible and nimble, as Dr. Marsh has said. In doing so, you really can carve out a wonderful future for yourself in this field and the impact you'll have on the folks you're serving. Thank you so much for your time this afternoon. I've enjoyed it. It's been brief, but I've enjoyed it. And I always enjoy an opportunity to share something with you along with Dr. Marsh.
Likewise. And it's a delight to co-present with my esteemed colleague and friend, Dr. Davis. Be happy to answer any questions. I know we've run into the lunch break. I will be happy to stick around for a few minutes if anybody has questions. Otherwise, I hope you all will be able to stick around for the sessions this afternoon.
Absolutely.
Yes, and I just want to echo those sentiments as well. We want to thank you, Dr. Marsh and Dr. Davis, for sharing your tips and insights about the critical issues in clinical psychology. It's been truly an informative session. And so thank you for contributing today. I'm going to post a link in the chat so that you can take a break for about 20 minutes or so. And then the next session is available through a link in the session catalog. So I posted that in the chat. It will begin at 15 minutes past the hour, and the title of that session is The Broad Reach of Social Psychology. And as Dr. Marsh mentioned, there's an exciting afternoon of sessions planned, so we hope you can join us for all of those sessions that fit into your schedule. And we'll see you after the break at 15 minutes past the hour.